Hello, everyone. Welcome to Meditales with the Portatile Doctor, where I will reveal the accuracy and realistic feasibility of medical content found in scripted and unscripted works, such as movies, TV shows, adverts, novels, and books to facilitate public health education. Don't forget to visit our website and blog today. So, moving on to something exciting, we will be reviewing. Can I get some drum rolls, please? Strain. Strain is a 2020 Nollywood movie directed by Uduak Obong Patrick and produced by Oluwatoyin Adewumi and Benjamin Abejide Adeniran. This movie deserves all the awards it got because the movie accomplished its purpose on public medical education regarding the sickle cell disease as demonstrated by its well-prepped movie characters in which an excellent job was done. It is apparent that the movie production team sought the advice of an expert medical professional in the execution of this movie. That is why its level of medical accuracy is high. Everything depicted in the movie is quite plausible in real life to a great extent. Seeing Dr. Chinonso Fidelis Ejemba in this movie raised my expectations in the accuracy of the movie's medical content, given his reputation in public health education from his various educational posts on various social media platforms. I expected no less in the medical accuracy of this movie. I can say that my expectations was not only met but also exceeded, appreciating the extent the movie took to explore bone marrow transplantation, rehabilitation, and return to pre-morbid states of living. Now, back to the movie. The risk factor for the disease was established during the interview with both parents, in which the mother of Ekene is noted to have the AS hemoglobin genotype, while that of the father leaves room for doubt, for which a second opinion test was recommended. This is plausible in reality, as both parents needed to have a sickle cell trait to have a child with the sickle cell disease. In establishing disease symptomatology, the parents were curious as to why Ekene did not show similar symptoms in the past, which led to his now current admission. The movie viewer gets to appreciate the subtle symptoms the doctor drew their attention to regarding easy fatigability and headaches, which could be from anemia or hypoxia that could occur due to the sickling of the red blood cells under certain predisposing conditions. All the symptoms mentioned are quite plausible in reality. The acute events that led to his hospitalization, from the physical exhaustion from the birthday activities that led to a fainting spell, is also plausible in reality. However, the rapid response of pre-hospital ambulance service in this scenario, though ideal, might not always be the reality, either due to unavailability or delayed due to traffic and lack of dedicated lanes for emergency services on our roads. Interaction with the doctor demonstrates that Ekene would be on some medications for life, although the names and function of these drugs were not stated. While I understand that their names and function might have been deliberately omitted to avoid the encouragement of self-medications by affected viewers, it would have been nice to state why these drugs were needed based on their function. These medications usually include a malaria prophylaxis, given that Nigeria is in an endemic region for malaria infection, as well as blood formers due to their risk for anemia. Now, You see, the doctor recommends genetic counseling for a Kenneth's family. The genetic counselor did a good job to explore the impact of the disease on the family unit as well as their future. However, there is a shortcoming here. If a hospital or medical counselor was stated, then this aim would have been achieved by what was displayed in the movie. Because the term genetic counselor would require that this person would review the family and medical history to learn how certain conditions, in this case the sickle cell disease, was inherited, and to provide information regarding genetic or genomics that allows them to make health related decisions, which in this movie culminated in bone marrow transplants and then the search for a donor. Now you see, this family unit was going to struggle with the frequent crisis that Ekene was going to experience and the subsequent need for his sister to be a donor, whom initially did not agree but subsequently changed her mind. The role of the genetic counselor would have been quite invaluable in getting them to this point at an earlier stage rather than the delayed period in which it took till the event of the stroke that occurred. Now, we would move on from here. Now, you see, when we talk about genetic counselors, it is important for us to know their roles because the parents, are they going to have other children? If so, what advice would be given to them given the fact that now they have had a child with the sickle cell disease? Would they want to have more children who might also come down with similar illness? Was there any discussion to involve Ekene's sister to know what her hemoglobin status was? Because this will be important for her in fashioning out her future regarding her hemoglobin genotype status. Also, it is also important for Ekene before or even after bone marrow transplant to consider what kind of life would be adopted following the discovery of his hemoglobin genotype and what future in terms of partners, or children that he might want to entertain after the bone transplant that took place later on in the movie. Now, in the course of the movie, the viewers can appreciate the frequency and severity to which Ekene experienced his crisis and the impact on the family unit. All these culminated in a stroke, which is a rare and grave occurrence in patients with sickle cell disease. The risk of stroke, as explained by the medical character in the movie, increases with the increasing frequency of crisis, and its occurrence requires prompt intervention. Surviving stroke is highly possible when there is early presentation, which was depicted in the movie. The close observation by Ekene's family members helped in the early identification of the stroke, and the call to their managing doctor was appropriate. While it might be difficult to always have access to one's managing doctor, access to a healthcare professional who can make an accurate judgment call to facilitate early presentation in the presence of an emergency is priceless. A video call and a quick assessment by the doctor was appropriate and plausible in reality. The doctor dispatches the hospital ambulance that gets to Ekene's home in time and back to the hospital to get clot-busting drugs to dissolve the clots is quite commendable, but this may not be as rapid as it was depicted in real life. A neuroimaging would have been useful in establishing a clot as a cause of the stroke. However, in the setting of sickle cell disease, a clot is most likely. The discussion about the consideration for bone marrow transplant due to Ekene's frequent and now severe crisis is now merited, which in real life would be the case. The explanation about the procedure is complications to both donor and recipient, as well as plans of mitigation, is appropriate at this point. We appreciate the journey through the procedure, the rehabilitation, and the return to Ekene's premorbid state of functioning. And we can see that he became as active as he has always desired to be, and the family unit returning back to a place of happiness and harmony. I will say kudos to the team for a great job, well executed. I believe that the high level of medical accuracy can be attributed to the due consultation with an expert medical professional who gave expert counsel in all aspects of the movie, including props and execution. Well done. At Pulsatile, we offer script doctoring and analysis services and is available to address the medical contents of scripted and unscripted works in and out of scenes as well as post-production, editing and evaluation. Call us today and we can help you make your movie, your book, your TV show, and any other work you desire to have a high level of medical accuracy. So, what are you waiting for? Visit us today at www.positile.org.ng. Positile, quality of life getting better.